that I would not.
Santa Clarita's hometown station, AM 1220 KHTS, Prima Pediatrics Healthcare Hour on your hometown station, AM 1220 KHTS. Of course, you can go to hometownstation.com for more information, primapediatrics.net, or call 424-9000. And Dr. Feldman joining us in studio. And you had an interesting experience actually in Israel. You just went the last couple weeks of summer, right?
Yes,
and
I did.
you had quite an interesting experience. Talk to me a little bit about that.
Well, I'm sure a lot of people who know me know that my older daughter is a pediatrician in Israel, and she lives there with her family. She has 3 children. And we went to visit them because we were actually running grandma-grandpa day camp for the kids.
Ah, nice.
Because it was the 2 weeks in between the end of day camp and the start of school.
All right.
And, of course, we were helping them prepare for school, and lo and behold, I found out, and I've since corroborated it, but my daughter told me that there is now a very big concern about polio. And, this is actually polio season. For those of you who were born after 1954, 55, basically, you've never experienced polio season. I did, and I have enough of memory to remember what it was like. But polio season were the months of August and September. That was the highest rate. And in the old days, before the vaccine, kids got polio all the time. And I recall my parents not letting us go to the beach or the state fair or any crowded places at all in August or September because it was polio season.
Really?
Oh, yeah. And because, if you got polio, about 80% of the time you just get a stomach flu, and about 20% of the time you'd end up paralyzed or dead.
Yeah.
And I remember...
And your parents were adamantly opposed to you guys being dead.
Dead, yes. It was not in their thing, yeah.
Yeah.
And,
maybe sometimes they were a little upset with
sometimes,
you. But
not always. Yeah. But the truth of the matter is that, when I was growing up, I remember in my kindergarten class there was a kid who walked with crutches because he'd had polio, and I remember the rabbi of our synagogue had polio, and,
And this but you're saying this is happening in Israel.
Here's the deal. And, at one point, by about 10, 15 years ago, the only places that there was still polio virus even circulating, that there were any cases of polio, were in India and Pakistan. Now, since then, polio has spread. People think partly due to international travel, but also partly due to the unrest in Middle East and Africa, because now polio is present throughout the Asia Minor Peninsula, and it is also present through the entire continent of Africa. What's happened, however, is that in some of the more advanced societies, such as Egypt, with the unrest has come decreased sewage control, decreased availability of immunizations, and so poliovirus has made its ugly head rear in the entire African continent. This past summer, approximately June of this past year, Israeli authorities in public health started noticing, because they do surveillance all the time there, because it is actually a Western civilization country, they found a few rodents with wild polio virus in them in southern Israel along the border to Egypt. And by about a month and a half ago, they'd found even more. So that they have not had any cases of actual polio in human beings, but because of the increase in the number of animals carrying wild polio virus in southern Israel, they made a fiat decision that they are re-immunizing every child in Israel with the oral polio vaccine. Now, my Israeli grandchildren, who are also American, by the way, they have all had the inactivated polio vaccine, which we had switched to exclusively about 15 years ago here. And the switch was made because there was still a small danger, 1 in 100,000, theoretically, up to 1 in a million, depending on which study you looked at, that could get polio from the actual vaccine, because the live vaccine was a live attenuated virus.
Yeah.
So because of that, and because there had not been any reported polio in the Western Hemisphere for 10 years, they switched to inactivated polio vaccine, where there's no chance you're going to get polio.
Yeah.
So, and my understanding at the time was that the difference between the two vaccines was primarily the slight risk on the oral polio vaccine, and the reason the oral polio vaccine had been used so much is because it conferred immunity, what they call herd immunity, meaning that if you vaccinated a child with oral polio vaccine, they would excrete the attenuated virus, and other kids who played with them would also become immune whether they were immunized or not.
Oh.
Okay, and that's what I thought
Wow.
was the entire reason that oral polio vaccine had over inactivated polio vaccine. But it turns out I was wrong.
That's not the case.
I learned something new this past month, and that is that not only is oral polio vaccine superior to inactivated because of the herd immunity, but it turns out when you're dealing with live poliovirus, wild poliovirus, the oral polio vaccine is actually a stronger vaccination. It has a better rate of protecting against wild poliovirus than the inactivated vaccine, which is why they've turned around, because of the presence of the virus in animals in the southern section of Israel. They have now turned around and are revaccinating all their kids with oral polio vaccine.
Man.
So it made me stop to think. I mean, I go to Israel at least twice a year. I get on the plane with loads of Americans that go back and forth. Certainly in the Jewish community, it's very common.
Yeah.
In the Middle East, and people from the Middle East, they all go back and forth to the Middle East, where polio is all over the place now. Hey, how long is it going to be before we see polio?
Yeah, then
Here.
So get your kids immunized with.
I think now, I used to say, well, it's the one vaccine. If you don't want to do it,
it's
it's
polio.
okay. But guess what?
Yeah.
I was wrong.
Yeah, no kidding. Yeah.
Time to revaccinate,
Yeah.
time to vaccinate, and then I think it's only a matter of time before we go back to using oral polio vaccine. That is yet to come, though.
Okay.
I follow the CDC recommendation.
Okay. So we got about 45 seconds here. There's one more thing you wanted to mention about school lunches. We touched on sleeping, making sure your kids eating healthy, and exercise, especially
Right.
school's starting. But you wanted to mention something about
sometimes
school
are the
lunches.
only nutrition that a child will get in lower socioeconomic groups. It's a necessity, and breakfast. The problem is that in a lot of schools, the food is not nutritious.
Okay.
So it's up to you as a parent to look at that and make sure that your kid is getting adequate nutrition and is not getting second and third helpings and is not getting hamburgers and French fries every day.
Excellent. Dr. Feldman, this has been the Prima Pediatrics Healthcare Hour on your hometown station, AM 1220 KHTS. Dr. Feldman, thank you. Again, go to primapediatrics.net for more information. 424-9000 also. Thanks, Doc.
Thank you. See you next time.
Okay.
All right.